Thank you for joining in. So it's 7:05 at our time, and we'll be starting right away. Yes. You're all welcome to today's webinar on dementia. It was organized by Caregivers. They've been having the elderly series on caring for the elderly, and today's topic is dementia. Dementia is quite an interesting topic because there are a lot of misconceptions around it. As one gets older, you begin to wonder, is it just normal aging or is there something more to the forgetfulness? Today we have a guest who is very experienced in caring for the elderly, background in psychiatry, which happens to be the unit that sees most of these cases of dementia. So I'm really glad that we're able to have someone who is enlightened in this line and can share, tangible experiences of what it means, what dementia is about, how to recognize early signs of dementia, what support families can have for patients with dementia, because it can be quite distressing for the family. And then what treatment options are available. And for some of us that might be curious, how can it be prevented? It would surprise you to know that there are some preventive measures available. So we have more people joined in right now, and from my end, I'm happy to go ahead. Yeah. Okay. So without any further ado, I'll be going on to introduce our guest minister, our guest speaker who has just joined in person of Esther Adegbolagun. She's a medical doctor, background psychiatry. But before I go into the presentation for today, we have a special video to introduce the topic to us all. I want to believe the team is ready with the video and background. Okay, I'm just waiting on. Okay. I'll be sharing my screen so I can play the video. It talks about what dementia is. It's basically a brief introduction to what dementia is about. Sorry about that. I understand that it's the audio was not we weren't able to play it alongside with the audio. We would replay that towards the end, but we don't want to waste any more time. So I'll be inviting the guest speaker in person of Dr. Esther Adegbolagun. So I'll be reading her biography here. She's a senior registrar at the Federal Neuropsychiatry Hospital, Yaba. She has a passion for mental health advocacy, psychotherapy, and public health education. She's committed to advancing mental health care through clinical excellence, medical communication, and professional engagement. Our work focuses on promoting mental health awareness, reducing stigma, and improving access to quality and patient-centered mental health care. She's particularly interested in developing sustainable mental health systems that integrate psychotherapy, rehabilitation, and community-based care. Beyond her clinical practice, Dr. Adegbolagun enjoys planning impactful events, speaking, and mentoring young women. It's a great honor to have with us Dr. Esther Adegbolagun, who will be talking to us today on dementia. Can we share some smileys as we welcome her on board?
Okay, thank you, Bonike. Good evening, everyone. Can
Good
you hear me?
evening.
Good evening. Okay, I don't know why my video is not showing. So I think I will start spending the time it comes on again. Right? What do you think, Bonike?
You could try switching it off and then on. Maybe that will help. If not, we could just go ahead and start. Okay, so while we wait, okay, she's back. So while we wait on our guest speaker for today, I know we all have pressing questions. You know, one of the questions I came across was quite an interesting one, and it just shows how that we really need to do this and do this more. You know, there was a question whereby a family member was concerned. There happened to be someone in the family who kept accusing another person of, taking belongings, and it became very distressful for the family members because there was an argument. Apparently it was realized that the person in concern actually had dementia, and then they forget where they put their keys, where they put their money, and all they realize is their money was depleting. Somebody must be stealing it, not realizing that they were actually just forgetting where they keep their money. So this is just one of the questions we'll be answering tonight or this evening, in addition to many other questions. So it's for us to really rub minds together. What exactly is dementia? How can we recognize these signs early? What can we do about it? In the context of Nigeria of today, like what are the steps to take when you recognize these signs? What do you do next? Our guest speaker will be answering these questions and more. So get your questions ready. Feel free to put it on the chat box. Yeah, feel free to put all your questions, your concerns. If you know anyone with dementia, or if you're just concerned, or you just want to learn about dementia today, you're all welcome. Feel free to put your questions, your comments on the chat box. The team will be following it, and we'll be happy to answer all your questions. I'll be handing over to our guest speaker right now.
Okay, thank you, Bonike. Good evening, everyone.
Good evening.
Okay, I think that's better. You can see me, right? Good evening.
Yes.
It's nice to see you, Bonike. Good evening. Okay, good evening, everyone. I'm really happy to be here this evening. And like Bonica said, we'll be talking about dementia. We'll talk about how to pick it early, ways to prevent it, if there are ways to prevent it, possible treatment options, and how to also care for the loved ones and even those caring for those that have dementia. So I'll start with what's the statistics that is going on now. And it's been said that dementia is becoming prevalent. There are about 10 million of cases of dementia every year. And WHO says that 55 million of people are currently living with dementia. And that proportion, 60% of people are living in the low and middle income country, which Nigeria is part of that population. And sadly, by 2050, that proportion, that number would are set to increase by fourfold. So from 55 million, we'll be having about 139 million cases of people living with dementia. So now I'm sure that you're wondering, oh, why is the number high? Why do we have increase in that and all of that? And that's because elderly ones, they are living longer, right? So that's why the number is increasing. Another thing is that there's now access to healthcare. Another thing is that because of increasing awareness, so that's why the number is that much. And for example, we are here to learn about or to be aware about dementia and how to pick it up. So when we listen to things like this, it makes us to quickly realize that someone is suffering from dementia, and we tend to go to the hospital quickly. And such people are part of the statistics, and that increases this number. So today we'll be covering that. So I'm going to start with, it's normal to forget. We all forget things. I'm sure we all forget things. So there are some times when you will misplace your keys, you will misplace your phone, you will know where you kept a pen. And I'm sure that you would not think you have dementia. I'm sure you would think that, oh, it is normal for you to forget. And let's even go to the elderly, because that is why really we are here, the care of the elderly. All right. I'm sure you have people that are elderly in your neighborhood, your family, your workplace. And sometimes that when you're having conversation with them, they forget things. And sometimes some of them might even remember those conversations, but later on, they might remember the details of the conversation later on. Sometimes some of them do not remember. And sometimes you might be wondering, oh, is this person suffering from dementia, or is this just part of normal aging? So we'll be talking about the differences. It's good to start with the differences between a normal aging and dementia, right? It's good to start with that. So it's normal when you see an elderly one that makes a bad decision once in a while, right? You notice that just once in a while you just make a bad decision. You won't think that this person has dementia. But when you notice that this elderly person has poor judgment with money, the person has problems with taking care of their self-care. For example, they probably don't know how to have their bath again, or maybe when they wear trousers, a particular type of trousers, they wear a different shirt on it, or they will not even remember to cook. People that know how to cook before, they can't cook again. Then you start raising your concern that could this person have dementia? And I know that, and sometimes also when you are in conversation, sometimes we might forget some details of this conversation, right? We won't think that there's a problem with us forgetting. But when you notice that the elderly person can never remember that they had this conversation, then for that person, you should think that, oh, I need to seek help. This is looking more than normal forgetfulness. Another thing that I would like us to also draw attention to is, so now let's give an example. An elderly person has been living in a place for the past 20 years. The person goes to the supermarket, right, every day, knows the go to the supermarket every day of life for the past 20 years. And all of a sudden, the person doesn't even know the way around the neighborhood. The person is getting lost around the neighborhood. Then such person, such person to seek care, because that is not normal. You know your way around that place for 20 years, but all of a sudden you do not know your way around. And I'm sure that we also have elderly ones that have called us several times to help us with phone. Like when you get a new phone for your elderly one, they don't know how to install some of these new apps, new technology. We won't say that they are forgetful, right? Because that's a complex task. But when you find an elderly one that normal routine in their life, like how to follow a recipe that they have known before, they don't have difficulties with their normal routines. Such person such person has to seek care because of that. So we'll be talking about early signs later on as we progress, but this is just to draw attention to the difference between normal aging and a possible sign of dementia, as it is normal for us to forget. It's part of aging. But when we are concerned is this thing has gotten worse, and now it's severe enough to disrupt the daily activities of that individual, and that's when we are concerned. So, like I said, dementia or forgetfulness can happen once in a while, but when it becomes frequent, when it becomes something that happens every day, something that happens weekly, and or the progression is worsened over time, and it interferes with their work, their finances, their way of living independently, then such person, when you put all of this together, such person needs to see a doctor so that proper assessment can be done, and there will be proper management that has to manage this person. So next slide, Bonike. So now let's just talk about the early signs of dementia. I think I've said a bit of it when I was differentiating between the normal aging and possible sign of dementia. But it's good to hone down into it. Like, let's look into it one by one for us to know how to detect this. So first thing on my slide is memory loss disrupting life. So one of the things you might notice for people that have dementia, you notice that recently learned information they cannot remember. So example, maybe a visitor came to visit them today, and they didn't even they don't have an idea that that they had a visitor. So such things, like you should raise your concern that this person might have dementia. So I'm using might because there are a lot of things that we put together before we can say dementia. We don't just check memory loss, because dementia is a decline in cognition, right? Not just memory, and there are several components to cognition. So that's why I'm using might, right? Then other signs that you can notice first is they have problems with solving. They have problem solving and with planning. So someone that can manage their finance before, someone that knows how to follow recipe, but all of a sudden let's say they want to cook a pot of jollof rice, right? Okay, several people have, okay, let's do white rice, because several people have different ways they cook their jollof rice. They want to cook white rice or something, and the first thing is to say, put water on the fire, right? Or before that, you have washed your rice, put water on the fire and all of that. But someone that knows how to do all of that before, then all of a sudden, the person just puts the rice on fire without washing the rice, puts water, maybe puts a lot of seasoning. She wants to cook white rice, right? But she's now putting seasoning and all of that. You should be concerned that what is going on with this person? What's going on with Mama? What's going on with Baba? Why are they doing things like that? So they have problem following recipe, or they have problem with familiar tasks that they have known before. So, and you also can notice that this person hardly forgets appointments or forgets tasks that they know how to do before. But you notice now that they will miss appointments, not just once in a while thing, but regularly. They are missing their appointments, hospital appointments, maybe visa appointments. You just notice that they are missing things that are very important to them. Like I said before, they have difficulty with familiar tasks. So they know how to manage their budget before. They know how to recall their favorite game rule, right? Then you should be concerned that this person probably has dementia. So you'll be wondering, like, an elderly person can be slow when they are doing even their familiar tasks, because yes, aging, there will be sort of memory decline with even aging, which is not dementia, right? They might be slow with it. But when it becomes they have difficulty with familiar tasks, that's when you are concerned. Another thing that you can notice is that you ask them what is the time of the day, and they are telling you that they're in the afternoon when it's at night, or they are telling you that they're in the rainy season when it is sunny, or they are telling you that, or they don't even know their names of their children. Okay, I'm sure that sometimes we forget the names of our friends or people that we have seen a long time ago. But all of a sudden, the names of people that are close to them, their loved ones, they don't even remember it, or they even mix the names. For example, calling Bola for BC, or Shalewa for Chinedu, which does not happen before. Right. Another thing that you notice is that they have problems with knowing their way around. So even in the house, instead of going to the toilet, you see them going to the kitchen, right? Instead of placing something in on the table, they put it in the fridge. Like, so I gave an example of misplacing things. So it's like, let's say they have a car key and they don't know where they kept it, and you just notice that you find it in an unusual place, seeing the car key in the fridge, seeing the newspaper in the microwave. These are odd places to keep. That's because they were not oriented as to where things are. So yeah, you can move on, Bonike. So the less obvious signs that can also happen, which are often missed, is, for example, they have problems with new words. So they before they know what is a wristwatch, but now when they're having conversation instead of saying, "Oh, this is a wristwatch," they would say that thing you put on your wrists. That's because they have difficulties with finding words. So when you notice, so these are things that can raise your concerns that, oh, what's going on with the elderly one. Then you also notice that they pay less attention to their care, self-care. So I mentioned it earlier, they paid less attention to their hygiene, to their grooming. And you notice that a lot of time, these elderly ones now are the ones that can get scammed because they just pay less attention to their money. They don't even understand, they cannot really understand what's, if I give you 1,000 naira, this is what you will get, right? So they are very prone to scam because of this. You also notice that people previously ones that were very socially extroverted, they had clubs they used to go to the church, they had like social group supports where they always engage before, and you notice that all of a sudden they prefer to be at home. They are not interested in going out like before. And all of these can also raise your concerns, and sometimes they can be irritable. Yes, elderly ones normally can get irritable as they age, but when it becomes problematic, is very little thing that does not warrant irritation. You notice that they tend to have it, or probably they also even get more irritable when they are in unfamiliar places. So such people, you should be concerned about it. So it's oftentimes, you can move on, Bonike. Oftentimes, it's the loved ones that notice first. Why is that? An elderly one does not want to believe that they cannot remember something. So you find that many times when you ask them questions, so they might start the conversation, and later on they'll just jump into other things that are not relatable to what you're saying, in a bit to like bridge the gap of their forgetfulness. So they don't want you to know that they are forgetting. So they just like add things that are not even related just because they don't want you to know that they are forgetting. So family members and friends, loved ones are the ones that first notice this shift, and they tend to come. So family members will notice that their elderly ones tend to ask multiple questions. So you can even find that they will repeat the same story twice in one conversation, and they will not realize it. They can have a lot of bills that are unpaid, and they don't even realize that they have a lot of bills. Like I said earlier, they also would miss out on a book club or an event that they would never miss, which is unlike them before, right? So before we move to how dementia is actually diagnosed, I'll quickly just talk about, because one of the questions that I'm sure that we'll have is, what are the causes of dementia? I'm sure we'll have that. So dementia results from physical damage to brain cells that disrupts how they communicate, how they function, and how they survive. And there are different diseases that damage the brain in different ways. But the outcome is that some neurons in the brain stop working and they eventually die. So there are several types or causes of dementia. I have 10 minutes. I'm going to skip quickly. So I'll skip quickly to prevention so that we do not, maybe when we're asking questions, we'll talk about the causes. But there are some causes that are reversible and some that are irreversible, right? And probably when I'm talking about the prevention, we'll be able to discuss about that. So how do we diagnose that? That is really, you seek your doctor, you seek help from your doctor, then other things will be done, a proper assessment and all of that will be done, right? So yes, let's go to how to reduce the risk. Yes. because I'm sure that is on our mind. How do you want to reduce the risk? So like I said, dementia has reversible and irreversible causes. So let's talk about the irreversible, because that's one thing that you can change. So from early life, from like when you're younger to 18 years old, there's one thing that has been found to be a cause is low level of education. So one thing people can do, even from now, people, not even the elderly ones, from now that we are growing, because we will all grow older, right, is to build what we call the cognitive reserve. So read more, like read very well, because it has been found that people that are well learned, that have higher educational background, the chances that they will come down with dementia is reduced, even though they might come later have dementia, but the chances of that is reduced. Another thing is because there's a type of dementia that we call vascular dementia, which means that, so there are several things that can cause that. For example, you take care of your blood pressure, ensure that it's not elevated, ensure that you are doing regular testing so that your cholesterol levels are not high, you do not have diabetes, all of that. All of this can cause that. Then things like when people are obese, excessive alcohol intake, smoking, all of these can, cause. So these are things that one needs to limit to prevent dementia. So things like you need to ensure that you are physically engaged. So there's not you reduce sedentary lifestyle, because this has been said to increase blood flow. When you perform physical activity, it increases blood flow to the brain, and this can help to accelerate the cognitive reserve. Smoking too has been found to damage blood vessels, right? So I think we'll just move on. So we can move on, Bonike. So when we have question, so and let's now talk about treatments available quickly. So there are several treatments available for dementia, and so it's still based on the cost. So you need to find out the cost before you can find out before you can know the appropriate treatments for dementia. And treatments are usually tailored to the individual, so it's not like a broad-wide thing. We have to see the person, look at the front of that person, and assess properly and know the right thing, the right treatment approach for that person, right? So one thing first for such people is there are things that we call cognitive stimulation. So people that have problems with knowing the dates and all of that, it would be good to have calendars in the house that will state that this is the day of the week, have clocks that can tell them it's the time of the week. Even have people that will be calm with them to help them tell that, oh, this is Monday, this is Tuesday. This helps to reduce their agitation. It helps to, help them to see that, yes, helps to sort of build up the cognition that might still remain in them. So another thing is also there are several physical therapy, pet therapy, music therapy, as this has been said, to help to, sort of strengthen the neurons that are still in the brain, which can help with cognition. Then aside this, other therapies that are not drug, there are also some medications that has been found to reduce or slow down the progression of the cognitive decline, right? There are several medications that has been said. So dementia that doesn't have a reversible cause. For example, Alzheimer's dementia, it is not reversible. There is no cure for it, right? But the medications that are available can help to reduce the progression. So for example, let's say it will take something 1 hour for it to decline. The medications can make it take about, say, 10 hours for it to decline. That's like just giving an hypothetical example of how this medication work. So it will be proper for a person to seek help so that we can know what is right. So now basically, how do we now care for the loved ones? There's this saying that someone that cares for a sick person is also sick. So there's a great burden on the people that are caring for people that are living with dementia. First thing first is that we know that you can always seek help. Know that you cannot do everything on your own. Know that when things are getting so much on you, you feel like you are tired of it, there are opportunities for care homes, respite care that can relieve you of the burden for a while, for you to get yourself right, so that you can be able to take care of your loved one that might be suffering from dementia. And there are several, like for example, care home, caregiver that can also help to connect you to possible available resources that can help to manage patients with dementia or your loved ones that have dementia. So I think I'm going to stop now so that I can answer questions, right? And I'm sure that with question, I'm able to cover the other things I did not cover. Thank you, Bonike.
Thank you very much. At this point in time, thank you very much, Dr. Adegbolagun. That was very clear. You said vital words. In fact, while you were running through the signs, I could just recollect in like some elderly loved ones. I'm like, I've noticed this in this person. Could it be dementia? And that was just going through my head just to bring it back home. For some of us, we're like, okay, I'm not so old. But then we have elderly ones probably in Nigeria, probably out of the country, and we're wondering like, how can we support them? We are not there with them right now. What can we do to support? Well, there's good news around the corner because before the end of today's session, we'll be talking about how we can support our elderly loved ones, though you might not be physically there with them, but there are certain supports that are available for them. The next thing I wanted to highlight was, when you noted the loved ones are the first ones to notice, and I was like, that's so true. That's so true. I'm sure a number of people can identify, when someone is sick, the first person they turn to is actually their loved ones, family, friends, that those are the people that bear the burden of the stress. And I was happy that you were able to highlight some of these available supports and what we can do for them. That was really good. We have quite a number of questions at hand, and I don't want to waste any further time. But I just want to, I don't know if there's anyone we have quite a number of people on board. If there's anyone that wants to share any comments, any question at this point in time, feel free to put it in the chat. Would be happy to read it out. But if you want to unmute yourself, just to ask the question directly, that would also be good. Is there anyone? You can raise up your hand if you have something to say. Because the essence of this webinar is beyond just the theory. We really want to hear from, if you have an elderly loved one who currently has dementia, or if you're worried, someone and you're worried about caring for the person, you could just raise up your hand. Just let us know. We are happy to address concerns. We're happy to hear your comments. We're happy to also offer support in best ways we can. So you can always raise up your hand. There's a hand icon on the Google Meet page. Just click on it and we'll be happy to hear from you. Well, I have the following question at hand. Dr. Adegbolagun, someone would like to know. Says that I have an elderly loved one who keeps forgetting things, but I find it hard explaining to the person that person is forgetting things. So the question is, how do you explain to an elderly one who keeps forgetting things that they're actually forgetting things?
Okay, let me on my video. Thank you so much for that question. So, like I said before, right, elderly ones, they don't want to believe they're forgetting. That's something we should know. And we don't need to shove it on them that they are forgetting things. It's something we call validation therapy in management of dementia. So you don't need to really tell them that they are forgetting. So let's say they have something that you want them to remember. You can repeat it slowly for them in short words, in simple sentences. There's something that the occupational therapists do a lot because they are like people that really work hand in hand with us management of dementia. They call that like chunking. So for example, you give them, let's say that you want them to remember how to spell, let's say Peggy. Peggy is P-E-G-G-Y, right? Before show them that, then you remove the Y and all of that. This just helps them to stimulate what's like their cognition. So you don't need to shove it down their head that you are forgetful. That's normally that's not even correct for an elderly person, right? So you would you would just explain again, repeat yourself as much as possible for them, for you to just understand. That's it. Thank you.
Yeah, but that can be quite challenging because for me, speaking honestly, sometimes you speak to probably your parent and they ask you the same question over it, and sometimes you're like, I just answered that question, and they are like repeatedly. So how can like middle age, young youth people cope with repeatedly asking the same question? And also, I want to. There's another question to add to it. How early does dementia start?
Mm. Okay. So I would say that when we all get old, so we should understand that one, right? It can be frustrating, really, repeating yourself. But remember that these ones are like, would I say, they are. I won't want to call them baby because that can be sort of like a stigma for
Yeah.
them, right? Won't call them baby, but you should know that you repeating yourself is showing that you love them, really, you care for their health. So we should not get tired repeating ourselves, right? Because this cognition will even decline over time. But if you have it in your heart that, oh, my elder one is forgetful, and you know that this is a curse I need to bear, you will not get irritated when you have this. And most times this irritation comes because you are the only one giving that care. So that is why it's good to share the burden of care so that you don't get annoyed and frustrated. So how early does dementia start? So that's a big question because there are normally we know that the age for elderly is above 65 years, right? But there are, because I didn't get the time to talk about the causes. So there are several causes, like for example, Huntington's disease can cause dementia. And we know that this kind of disease can happen even as early as 40 years. And if such person as like someone has Huntington's, there's possibility that at 40 years you can have dementia, right? But yes, we know the average rate is from like 65 years. That's for like normal onset you expect. When you are seeing things as you have like some 55 years old people that have dementia, we call that early onset dementia. It is possible. Well, averagely, we know that it is a disease of the elderly, but that does not negate that or does not remove the fact that younger ones have possibility because there are several reversible. For example, if someone has nutritional deficiency, it can cause forgetfulness, not even dementia. But if that is not corrected, right, you might think the person has dementia. So thank you.
Thank you very much, Lillian. I can see your answer. Hope we're happy to hear from you. The floor is yours. You can unmute your mic. Lillian Chuku.
Yeah, good evening. Good evening. Can you hear me?
Yeah, we can hear you.
Okay. That's an insightful presentation. Please, my question is, yes, dementia is meant to be old people is for maybe from 65. That is, does it mean that someone that is below 65, someone that is like between 20 to 40 years, that is always forgetting something? What would you classify that, and what can the person do to address it?
Thank you very much for that question, Dr. Adegbolagun.
Thank you, Lillian, for that question. So I said earlier that there are several causes of dementia, and based on those causes, we have like different age at which forgetfulness can come to play. For example, dementia, so depression, people that have depression, sometimes they can have forgetfulness as part of their complaints. And let's remember that dementia is not just memory loss. There are other things that come to play before we can say someone has dementia. I think I mentioned it when I was talking earlier, right? Forgetfulness is normal. It's normal. But when it becomes continuous and it's severe enough to affect your
Okay.
daily movement, right? Then that's when we're thinking of dementia. It's not just like it's a disease of the elderly, yes, but does not mean that you cannot find it in younger
Okay.
ones,
Thank you.
right? Based on the several causes, right? So based out, what is the help? Once you notice something, it's good to seek help, and that's why the caregiving is available, right? It's good to seek help. Proper assessments will be done according to that individual. We're able to know what is the cause and tailor the treatment according to what we find. Do you understand? Am I audible?
Yes, we can hear you. That was clear.
Yeah, yeah, we can hear you.
Thank you very much. Appreciate that. One of the things you mentioned triggered a question. I came across someone who was really curious. There are a lot of things now, from herbal medications to various mixtures and more. What's your take on that? Are we to start using supplements? Say this one to help forgetfulness. This one, your brain will be sharp when you're 85. Things like that. You can be president. What do you think? You're muted.
Okay, so aba mixture. I would say that so a lot of our medications are from they're plant-based really. And why we use this medication, because they have been tested according to dose, and we know the appropriate dose to give for this particular thing. Yes, I know that there are some supplements that sort of help to boost memory, not to reduce memory loss, right? And even the medications for dementia, they do not return what has been lost. They help to reduce the progression of the cognition that the patient might have. So now there are also several.
I think we need to post that, everywhere so everyone can be aware.
So there are also several like supplements like vitamin E, and that's several things that cannot.
Where can we get vitamin E from? Just for someone curious. Sorry.
Our fish, right? All this fish. I think I don't know the name of the fish. I think it's Titus, yes, Titus and all of that, all these omega-3 fish and all of that, they are rich in that and has been found to help with that. So it's not that they will help to reduce the cognition, but it can just boost. And there are even limited research or study that this is true. These are just adjunctive measures that for boosting memory. So I don't know if I've answered that question.
Yes, you have. Thank you very much. So I have a question here. It says that there's an elderly one who keeps getting lost. Person was on a bike for quite a long time, and person forgets the appointments, and they don't know what steps to take. Like this kind of patient, what do you do next?
Okay, so getting lost. So one thing I would say for that is the first thing you can do is ensure that you tell people in the neighbor that Mama, whenever you see Mama or Baba, please bring her back to the house. Hopefully you have good neighbors that are able to. It was nice when we had this community that everybody knows themselves. We're always putting our nose into everybody's business. That period really helped. That's one thing that you can do. Another thing you can do is seek help so that medications can be given to reduce the progression. Then get a carer, because if Mama keeps getting out, there's risk of wandering, and you probably will not see that person again because they don't know their way around. Then another thing that I think is very important is you can on the risk of the elderly one, there could be emergency numbers. Like put there that if you see this person, if you see that, you can call the person. I call this number like that. So those are like steps that can help with people that have the risk of wandering.
Thank you very much. Probably the last question. It's in the chat box. It says, if a parent or grandparent had dementia, what would be the person's personal risk for dementia? Is it genetic?
So there is I like that question, right?
I like it too.
It's about 10% so it depends on the type of dementia. Let's start with that. Right. Alzheimer's dementia is like the commonest dementia, right, that we have, and it's about 10% familial risk. So because an elderly one had dementia does not mean you have dementia. So why I like this conversation is the prevention we're talking about is not for the people that already have the dementia. It starts from you. So even if you don't have anybody in your family that has dementia, you can start with building your cognitive reserve by reading, by studying, by not just I went to school, even like just building your reserve, eating healthy. So there's something that we call the Mediterranean diet that contains what is that? There are nuts in when you eat food rich in nuts, fiber foods, leafy greens, berries, beans. Those are food that has been like diets that can help to sort of reduce the risk of coming down with dementia, right? Then make sure that you don't live a sedentary lifestyle, right? Engage well, like speak to people well, ensure that you have like all this music playing. So all of this is reducing your risk. So because someone has it does not mean you have it. Where there are types of dementia that with anticipation, there's tendency that there could be the chance of you coming down with dementia, but proper care or proper access to treatments can help such persons.
Thank you. That was impressive, very enlightening. You answered all your questions well, and I'm sure we have a lot to take back home regarding dementia. I'm sure this session must have triggered some questions in your heart and or probably raised some concerns, and probably you're worried about maybe an elderly loved one that you would like to support or care for that probably might have dementia. I'm sure from today's teaching session you probably know what next to do, and it probably you don't even know anyone and you're just like, oh, how can I help myself? How can I preserve my cognitive reserve? Just like our doctor has said, you can eat fish, Titus fish, to boost memory. Basically, you can avoid social isolation, engage with people, communicate, have your community around, build your own community, reach out to people, engage basically. But another way to also help and support is what we call caregiving. Caregiving at the organizers of today's webinar, and caregiving is an healthcare organization with multidisciplinary professionals. Basically, we have a team of doctors, nurses, support workers who offer trained, qualified, comprehensive care it could be virtual consultations, could be home visits. So you could always sign up through the website, and there's a community available on WhatsApp if you're interested in knowing more about elderly care, caring for the elderly. It's basically a WhatsApp group that offers more educations like this. We can always let you know when we organize webinars like this, so you can be enlightened. Like I was having a chat with a colleague and I was saying that, it's high time we start advocating for elderly care in Nigeria. That's the whole essence of this. Fine, we have a very young population, but we have a growing population of the elderly as well. More people are living longer, and we are happy about that. But we need to make provision available for the elderly care. Elderly ones are, because of their physiology, it's quite unique in its own sense, in sense that you can't ramp them up with every other person. They need to be cared for specially. So if this resonates with you, feel free to join the community on WhatsApp. The link is on the chat box. And you could always sign up through our website, caregiving.app, for more information, and follow us on social media via _caregiving. Yeah, so we are coming to the end of today's webinar session. We try to keep to time within 1 hour because we want you to join in again anytime we have webinar sessions, because we promise to be prompt. We promise to offer enlightening sessions like today's session, and we'll encourage you to share the link with as many people as possible. Let's spread the news around. Let everyone get more enlightened about what it takes to care for the elderly, what dementia is about, and that way we can support families and friends worldwide. So thank you all for joining in today's session. I don't know if anyone has any comments or last words to say just before we bring it to an end. I'll just give a moment as well before we bring it to an end. So there was a video we're trying to play earlier on, but didn't play out. So we're going to attempt to play it again just before we go ahead. Do let me know if you can hear it.
Okay.
Okay.
Thank you all very much. We tried playing it again, but it's still not playing out. So sorry about that. Hopefully we can share it across our social media and you can have access to it there. So in summary, we've discussed about dementia. We had our guest speaker, Dr. Adegbolagun, who gave us a comprehensive talk on what dementia is about, early signs, and how to support families with dementia. We also spoke about preventive and treatment options available. One of things we mentioned regarding support was the availability of care from caregiving, and also the fact that we're also trying to create advocacy for elderly care in Nigeria. So feel free to join in again on our subsequent webinars, and thank you for today's session. Take care.
Thank you.
That's why you him and is that's in your or some you move it and I got or some also I'm gonna instead of some of my go. When you